Great.
Welcome everybody to the webinar on violent, nonviolent death tolls for the Gaza war. My name is James Pfeiffer. I'm a professor in the Department of Global Health here at University of Washington. This is an event that's co-sponsored by the Department of Global Health, the Diversity, Equity, and Inclusion Committee, as well as the Public Health for Peace and Justice in Palestine group here in the School of Public Health. So co-sponsors there. Before I jump into a introduction, I'm going to be very brief because we want to give Dr. Spagat as much time as possible. But I want to just say that Dr. Spagat's work is vital for two reasons, perhaps stating the obvious, but it's worth stating that rigorously documenting injury and mortality related to war crimes and genocide for use in international courts and other venues is vital. And this is the kind of work that Dr. Spagat is engaged in, is getting accurate, clear, methodologically sound counts of the human toll that could be used in international courts and other venues. But perhaps more importantly, even more importantly, the moral urgency to accurately document and acknowledge the human toll and profound suffering caused by war crimes and genocide. So I want to thank Dr. Spagat and his co-researchers for their work. Dr. Spagat is professor of economics at Royal Holloway University of London. He specializes in the quantitative analysis of armed conflict, including the measurement of war-related death tolls and long-run trends in war fatalities. And I just want to say that public health is slowly but surely moving toward a greater recognition of war as a huge public health challenge that we should be paying more attention to. His work has appeared in Nature, the New England Journal of Medicine, and the Journal of Conflict Resolution. Dr. Spagat is chair of the board of Every Casualty Counts and serves on the advisory panel of Action on Armed Violence. He holds a PhD in economics from Harvard University. So I want to say thank you to Dr. Spagat, and we are so thankful to you for joining us, spending this time, and sharing this really critical work. I'm going to turn this over to you now. The idea is that Dr. Spagat will talk for about 30 minutes, and then that hopefully will leave us about 30 minutes for Q&A. And we would ask folks in the audience to please submit your questions through the Q&A function at the bottom of your screen, and we'll be selecting questions from that to ask Dr. Spagat. So thank you so much, and I'm going to turn over the floor to Dr. Spagat.
Thank you so much for that kind introduction, and thank you for the invitation. I'm delighted to have this opportunity to present to you. So, there we go. All right, so as was just stated, high-quality mortality estimation is critical for understanding the human cost of war. However, it's difficult to get decent estimates in the middle of active conflict, which doesn't mean that we shouldn't be trying. Remarkably, the Gaza Ministry of Health has been providing regular updates on the violent death toll of the war in Gaza since October 7. However, these reports have attracted both support and criticism. They have been controversial. And so at the moment when we undertook this survey, there really did not exist an independent population representative survey that could provide some independent assessment of the extent to which the GMOH might be getting it right, or what might be some of the issues with what they're doing. So we went in there really with three main goals. One, to get independent verification or perhaps lack of verification of violent deaths, to get, again, an independent handle on the demographic composition of deaths, meaning breakdowns into age and sex categories, and also to gather some information on nonviolent excess mortality, that is, nonviolent deaths that might be indirectly caused by the war. And I have to say that when we undertook this study, there was virtually nothing to go on in that area, as opposed to the violent deaths where we had the GMOH and we had some other information that I'll be referring to later in the talk. But for nonviolent excess mortalities, there was almost nothing. So we were really the first ground-based population representative survey during the active conflict. Um, at least we tried to be population representative, and we'll talk about that. So the field work for this study was conducted between December 30th, 2024 and January 5th, 2025. At the time of the survey, there's no way to know with complete precision, but we think that something on the order of 80 to 84% of the Gaza population was displaced at the time, and much of the population was also inaccessible either in the north of the Gaza Strip or in Rafah. Perhaps as many as 500,000 people, so maybe 22% were inaccessible. We drew a sample of 2,000 households. Almost everybody that we approached agreed to be interviewed, 97.2% response rate. Those households comprised 9,729 individuals as of October 6th, 2023. And the sample was stratified by dwelling type. So with much of the population displaced, we had quite a large percentage of the sample were either living in tents or in built shelters that had been converted, for example, schools or mosques that had been converted into housing. So some key features, pre-survey, that should say tracking, pre-survey tracking of displaced populations. I'll come back to that in a second. We did get readings on people from the inaccessible areas through the people that had originated in those areas and had been displaced to the areas that we could access. And then we weighted the sample using a procedure called raking, which is basically designed to bring the population proportions according to various measurables to bring the sample proportions according to various measures into line with the population proportions. Okay, so um, uh, we weighted, for example, by government of origin. So to the extent that the sample didn't reflect the original distribution of governments, it was actually extremely close there. So that was a really minor adjustment. An important adjustment that we made was that our sample had household sizes that were lower on average than what we think the average household sizes were in the Gaza Strip, and so we upweighted large households and downweighted small households. The questionnaire asked for the vital status of all household members. Essentially, are they alive or dead? Some other information, but that's the key thing that we were trying to figure out. And if they're reported as dead, we distinguish between violent deaths and nonviolent deaths. And although I mentioned that we tracked 9,729 individuals who were alive as of August 6th, we also recorded people who were born during the survey, but there are not so many of them. They're a small part of the sample. So the estimates, if we were to exclude the births and then some deaths of people who were born, they come out almost the same. So we counted for it, but it doesn't really matter very much. So there's a huge fieldwork challenge here, which we addressed by having 10 two-person teams operating in the conflict zone. It's important to understand here that we did not enter Gaza in order to conduct the survey. We were, in effect, already there, or our Palestinian partner, the Palestinian Center for Policy and Survey Research, already had survey researchers, experienced survey researchers on the ground in Gaza. They're Gazans who live there. And in fact, they had conducted a few public opinion surveys during the war. Okay, so we didn't send teams in there. There was real-time monitoring of the movements of the teams using GPS, which is there mostly to just try to keep them as safe as possible, so we knew where they were. The teams moved freely, but only within the governorates of Han Yunis and Deir al-Balah. Northern Gaza, Gaza City, and Rafah were physically inaccessible to us. Absolutely essential to this, in the sense that this never would have happened otherwise, is that the Palestinian partner, the Palestinian Center for Policy and Survey Research, had been tracking the population movements throughout the war. So from the beginning, they were updating their lists of where people were. Obviously, we couldn't rely on the latest census to find people and to draw our sample, but working in coordination with government agencies, UN agencies, NGOs, particularly aid agencies that have to know where people are so that they can distribute aid, using some satellite imagery and ground verification. Basically, the PCPSR constructed a sampling frame that we used for this survey. And if they hadn't been doing that right from the beginning of the conflict, there's no way that this could have ever happened. We benefited from the fact that there were no major population movements in the last couple of months before the survey. Main finding one, violent deaths far exceed the official figures. So we estimated 17,200 violent deaths with a 95% confidence interval running from 63,600 to 86,800. That comes out to be about 3.4% of the Gaza population. Bear in mind that these are deaths that would have occurred between October 7, 2023 and January 5, 2025. So, some months ago now is the end of our reporting period. The comparable figure from the Gaza Ministry of Health for that period is 49,090. So they're about 34.7% below our central estimate. And you can see here how much lower they are, the bottom of our confidence interval. They're about 14,500 below that. I mentioned that there was another important study that had been carried out here. So this was a study using completely different methodology, capture, recapture, by Jamaluddin et al., 2025. And they have only a violent death estimate, not a nonviolent death estimate. Their violent death estimate they found was that the GMOH was about 40% below their estimate. Okay, so 35% below our estimate for a different period, covering an additional half a year, and 40% below the Jamaluddin et al. Estimate. So that is pretty close, actually. So that's remarkable congruence here of findings. Good consistency between the two. As for the demographics, we found that as a central estimate, 56.2% of our estimated violent deaths were of either women, children, that is under the age of 18, or elderly, that is above the age of 64. And you can see confidence intervals for those sub-estimates here. Again, we had quite a remarkable match. I shouldn't say maybe again, because we didn't have a remarkable match for the central estimate for violent deaths. We do have a remarkable match for the demographic composition of the violent deaths. Okay, so I'd say 54% versus 56.2% is barely different. Third, nonviolent excess deaths. So the total estimate for nonviolent deaths based on our sample was 16,300 with a 95% confidence interval running from 12,300 up to 20,200. But for an excess figure, we should subtract off the number of nonviolent deaths that we would have expected to happen if there hadn't been a war. It happens that the US Census Bureau had done projections for exactly that, projections that were constructed before the war started. So that comes out to 7,716 for our period. And so in excess of 8,540 with a confidence interval running from 4,540 up to 12,500. So that is a lot of death. However, it is lower than some projections that were made. So there was a claim that gets cited a lot in discussions of the Gaza death toll. And a lot of people seem to think that this is some kind of law of nature, that you get 4 indirect deaths for every direct death. But what we get is not at all consistent with that. There was also a claim circulating that even back during our coverage periods, there have been tens of thousands of starvation deaths. I don't think that's close at all to being correct. Mind you, we need to point out a few things here. Conditions worsened, and I think probably worsened substantially after the survey. Actually, they got better briefly because there was a ceasefire, but then when the ceasefire was broken, and then Israel imposed a complete siege on aid, a complete ban on aid entering the area, I think things got much worse, and the IPC even declared a stage 5 famine in August of 2025 in Gaza City. So I think that nonviolent excess deaths will have increased. I can't give a data-based estimate, but I think there would have been a substantial increase. Pursuing this issue of the ratio of indirect to direct deaths, I'll just say that this 4-to-1 ratio is hardly a sort of an iron law of nature. And in fact, depending on circumstances, you get quite a wide range of ratios. So for the war in Kosovo, for which we have exceptionally good data, almost all of the deaths were violent deaths. We've got a decent survey for Yemen, which found that violent deaths were twice nonviolent deaths. So here we're actually somewhere in between. Now I cite 2 more studies right down here, and they get de-emphasized in the slide because they're not in the graphic. And the reason they're not in the graphic is that it would be too complicated to put them in the graphic. But I will say that for the studies we've got for both Darfur and Tigray, there was certainly quite a high ratio of indirect to direct deaths. Okay, so from the graphic, we should not conclude that it never happens that you've got a huge ratio of indirect to direct deaths. But the problem with displaying these is that for Darfur, the nonviolent death rate varied hugely by period. There were 6 different periods covered in this study, and they range between 0.49 per 10,000 per day all the way up to 5.86 per 10,000 per day. High rates, very high rates, especially at the top end, but there's just so much variation. And T grade also varied hugely by age group. Okay, so in a way, this does reinforce the general point that there's a lot of variation based on circumstances. But I don't mean to deny that there can be a very high ratio, but I just don't think that we should be really shocked that, at least for this period, we don't actually find it in the Gaza Strip. There are a lot of limitations here. For sure, there needs to be follow-up work conducted under stable conditions. I'm sure that we can get a better quality estimate. This slide, I just highlight 5 things. Actually, 3 of them go in the direction of underestimation, and 1 in the direction of overestimation, and the final one is just emphasizing the uncertainty. Um, I just want to hide this. Yeah. So we can't sample. I mean, this is a general problem of such surveys, but we can't sample households that have 0 survivors. Because this is always the case with a survey, but in some surveys, I think it doesn't matter much because there isn't good reason to think that there were a lot of households that were entirely wiped out. Here, there certainly were, I think, more than a few that were entirely wiped out, although we don't really know how many. There are, of course, the inaccessible areas. So, mind you, we attempt to account for deaths of people who originated in here it just says northern areas, but it's actually northern plus Rafah. We attempt to account for the people who are in those inaccessible areas, but we have to assume that people that were displaced from those areas experience the same mortality rate as those who were left behind those lines. I I could tell a story certainly for violent deaths that would suggest that maybe the rates are fairly close to each other, because I think there was a lot of violence that occurred specifically when people were in the act of um, displacing themselves, or moving to new areas. However, for nonviolent deaths, it seems quite likely that behind those lines, the rates were higher. Aid for some periods was just not flowing at all into those areas. So probably if we could have sampled those people, we would have got higher nonviolent excess deaths. Missing persons, we actually allowed on the survey people to report household members as missing, and we got a central estimate of 12,200. But we just presented that as an estimate of missing persons. We didn't add them on as presumed dead, or give some fraction that we think might be dead, because we didn't think we had any data-based way to do that. So in effect, we treated those missing persons as alive. It's worth pointing out that the demographics of the missing persons uh, lean heavily toward adult males. So if we were to include those, that would increase the percentage of adult males. Although we have some discussion then in the paper. It's not a massive effect, because 12,200 is a relatively small fraction of 75,000. Respondents might have overreported deaths, for example, reporting deaths outside their household, although I'll say that a major objective in our training for the people who conducted the survey was to prevent people from doing that. And the survey begins with a household roster And so people have to list everyone who was there on October 6th. And I think that that prevents a check against, just adding your uncle or someone who's not really in your household, but may have been killed. Also, as I alluded to earlier, the mean household size in the survey came out below what we think the mean household size is for the Gaza Strip as a whole. So that also suggests that this wasn't a major thing, but still, this might have occurred to some degree. And then I just want to emphasize that the confidence intervals that I've been quoting throughout really should be treated as minimum ranges. Again, I think this is true of any survey because the confidence intervals that are normally quoted are only capturing sampling variation. But here, I think probably the uncertainties are larger. The uncertainties that we couldn't capture are larger than in a typical survey because of the very difficult circumstances that we're operating in. All right, so let me just quickly try to summarize. So, key takeaways, they're right there on the left of this slide. I don't think I'm going to read them out because I've gone through them already. Okay, moving to the right side of this slide, we've got the first independent population-based survey. It broadly validated GMOH data. And I will say that I believe that the GMOH is doing reliable work, heroic work, even under the most extraordinary of circumstances. I can't get into this unless people want to bring it up in the Q&A, but I think the GMOH is extremely conservative. They're really kind of living in fear that they're going to get caught out overestimating the death toll or putting people on their lists who turn out not to be dead. And I think this accounts to a large extent for why their counts are lower than our estimates. Um, I think we can call this a rigorous mortality surveillance. Both what we did and what the GMOH is doing. Okay, so it is feasible even in the most difficult of circumstances, although better, higher quality work in the future is crucial. Okay, but I think we've at least helped to provide some elements of an empirical foundation for the historical record, perhaps for humanitarian response and for accountability. An interesting thing, really, for the future of the field of casualty recording and estimation is this quite strong consistency between our estimates and the capture recapture estimates, and I would say even the GMOH reporting, albeit with their reporting coming out lower than ours in the capture recapture. So that strengthens confidence in the use of these methods going forward. I want to stress that what the GMOH is doing is valuable beyond just the numbers, and I've been talking really relentlessly about numbers here, but what the GMOH is doing really extends beyond that. It's bringing some measure of human dignity to everybody who has been killed violently in this conflict. By naming them, providing some information about each person, in particular ages and sexes. This is really the essence of the work of the NGO that I chair, Every Casualty Counts, and I encourage people to Google Every Casualty Counts and have a look at the website and try to understand what we're all about. This work is really just beginning. The GMOH has made a great start to it, but it must continue post-conflict. So there has to be continuing monitoring, and hopefully the ceasefire holds. And first and foremost, just for the sake of the people living on the Gaza Strip, but it will also help us to document what has happened there. Okay, so just really briefly, since I'm repeating myself here, is that when we started, there weren't really anything, there wasn't really anything independent of the GMOH. We have that now. We also have some information on nonviolent deaths, perhaps weaker than the information on violent deaths to the extent that uh, it's a bigger limitation for nonviolent deaths that we couldn't get into the inaccessible areas than it is for violent deaths. Um, but anyway, there's some empirical foundation that we can build on. And well, I'm open to your questions now. But if you've got more that you want to follow up on beyond the Q&A, please just get in touch with me. Email is probably the best way to do it. And the data is available, freely available online. Thank you very much. Let me try to stop sharing my screen now.
Thank you so much, Dr. Spagat. That was really, really very concisely. You're a good model for those of us who give talks. Really, really got through it very, very efficiently and clearly. So thank you for that. We do have some questions in the Q&A. And I wanted to actually start out with a question that was coming from the organizers real quickly. What role do you think, sorry, let me back up a little bit. How do you hope these findings might be used for accountability? You mentioned that it was important for accountability. What is your hope as a scientist, as an academic, doing this work as a leader of an NGO? How do you hope the findings will be used for accountability, and what challenges do you see to that happening?
So maybe it's worth distinguishing here between legal accountability and accountability in the court of public opinion, so to speak. So, I think this is highly usable. In the second, I think from the legal point of view, I believe it's going to be more complicated. Perhaps the most important contribution here is that we broadly validated what the GMOH is doing. So the GMOH is collecting detailed records of individuals killed. And I believe that those will be of great use in legal proceedings. But they came under fire, and rightly so. I think that we should be scrutinizing data of this sort. I do think that much of the criticism that's been directed at the GMOH casualty recording has been not done in good faith. So I'm not saying that any criticism is valid criticism, but it makes sense to really have a hard look at it and scrutinize it. And I feel like they've come out very well and very validated here. And as I say, we should be building on that. They're very conservative. Lots of people have found examples of deaths that have been well documented in social media that don't appear on the Ministry of Health lists. So, the Ministry of Health lists are not complete, but I think that they're a conservative first pass, and I think that will be of great use in legal proceedings. There is another issue here, which is that we don't and we really can't try to pinpoint perpetrators here. So people report that a member of their household has been violently killed, but there's not a follow-up question to say who killed them, and for various reasons, including that often they really don't know. And that might also be an invitation for them to just blame people that they've got issues with. But overwhelmingly, it's fairly clear that these people have been killed by Israeli actions, but not 100% of them. And we can't really help a lot with that.
Great. Thank you so much for that really comprehensive answer. We have a question that's come in from the Q&A system that I'll just read quickly. Sorry if I missed this in the beginning, but can you share the definition of the violent versus nonviolent deaths once more? I've also heard critics discuss the difference between combatant or Hamas deaths versus non-combatant deaths. Am I understanding correctly that the violent deaths do not necessarily capture that distinction by person, but by manner of death? So they're wondering kind of how those categories are created.
Yeah, so um, I don't have a handy slide to whip out. You can access the questionnaire online. It's available. In fact, it's you can, well, if you have trouble finding it, email me. But the distinction is it's basically as reported by the respondents, but the question says something along the lines of, after making the household roster, then you go through each person and you say, is that person alive or dead? And if the answer is dead, then there's a follow-up question that says something like, was he killed violently, for example, bombing, shootings, etc., or non-violently, heart attack, giving a few examples like that. So people are kind of steered into an understanding of violent versus nonviolent. There is, if you report nonviolent, there is a distinction you can make, which is essentially coming down to whether you think it wouldn't have happened if there hadn't been the war. So nonviolent with medical care versus nonviolent without medical care. And that was meant as an outlet for people who want to blame the war for the death, um, but they're deaths that we don't regard as violent, like taking directly caused by an explosion or a gunshot or something like that. We also don't distinguish between civilians and combatants. So, dead certainty, there are a lot of combatants who have been reported in this survey. But we can't give a breakdown. We can do what various commentators, including myself, have tried to do in the public discussion, is try to estimate percentages of combatants by looking at the demographics. But there's no question in the survey that says, was he or she a combatant? So it's combatants plus civilians.
All right, thank you for that really detailed, excellent clarity. We have a question in the Q&A here as well. Did the study analyze the geographic death toll? There's an assumption that death tolls are higher in North and South Gaza versus the middle area. Any comments about that?
Yeah, so what we cannot do and did not do is attempt any analysis of where deaths actually occurred. Okay, so again, you report a death, and then you're not asked, okay, and where did this happen? People report their governorate of origin. Okay, but um, either in the sample, either they're actually still living in their governorate of origin, or they've been displaced from their governorate of origin and they're not living there anymore. So you can see in the paper, we don't make much of it, but you can see in the paper breakdowns by governorate. But this isn't governorate where people were killed. This is governorate where they originated. And uh, and if you're from one of the three inaccessible governorates, the deaths may have happened there where you originated. They might be where you are now. Actually, people were, in many cases, displaced more than once. So they may have occurred in a different governorate where you were displaced for the first time and you're not there now. So So you can see the breakdowns. It's in the data set what governorate they originated in, but we don't really make much of it because we don't know where people were killed.
Thank you. We have another question, a methodological one here. How does this method compare to verbal autopsy done in a non-combat country or situation? In particular, how does it affect the memory of the persons being interviewed?
Um, okay, so I've never actually worked with verbal autopsies. There are probably a number of people in this call that are more familiar with how those work than I am. But um, but I believe that those would go into much more depth about the actual causes of death. We have to bear in mind here that we didn't have a lot of funding. It's a short questionnaire. We didn't really have time to administer a detailed questionnaire. If we had administered a more detailed questionnaire on causes of death, um, we could have debated about how accurate it is. I mean, I think this comes up in general, even under um, calm circumstances, how well people actually understand the causes of deaths of people in their household. I mean, speaking for myself, I'm kind of hazy on the cause of death of my mother. I mean, I know it had to do with her heart, but I'm not sure, if I were administered a verbal autopsy, how it would come out. Now that was some years ago. Question of how it affects memories. Um, I'm not quite sure how to answer that. These are fairly recent memories. Uh, you know, the war had been going on for what, about 1.25 years when the survey was administered. So deaths that occurred would be somewhere between very recent and 1.25 years ago. Um, we didn't, maybe we should have, but we didn't ask for dates of death. So we weren't challenging memories that much, just sort of the fact of death and then classification into violent versus nonviolent. I imagine that, you know, people who had someone die, that was pretty well burned into their memory, although the details might not have been there, but we didn't probe too much on details.
Thank you for that. Um, just another sort of broader question about some methods, as you and the politics of this kind of work. You had also done work on death toll related to the Iraq invasion and war. And of course, those numbers have been challenged heavily. But in conducting work in other war zones, such as the death toll in Iraq War, can you highlight any similarities or differences, important similarities or differences between the war in Gaza and other wars based on your research, especially the Iraq War? Is there something distinctive and different about what's happening in Gaza in terms of how the war has been prosecuted and challenges to making every casualty count?
Okay, so I didn't ever do a survey in the Iraq War, but I think a really big difference is that this war it's far more violent on a per capita basis, right? So that the percentage of the population killed is vastly higher than it was in the Iraq War, and also this high percentage of the population killed took place within a pretty short time frame. So in terms of our survey, we were lucky in that we did it during a relatively calm period that hadn't had a lot of population movement beforehand. I mean, of course, maybe I should have said even like maybe the most glaring difference is just the extent of displacement, perhaps even more glaring than the amount of violence. Although obviously the two are closely related to each other. There was a lot of displacement in Iraq, of course, but here it's like displacement is the normal condition. Most people are displaced. So, uh, as mentioned earlier in the talk, that this would not have even been remotely feasible had it not been the fact that the Palestinian partner had been monitoring the population movements throughout in conjunction with international organizations, NGOs, local government. Uh, so now that I get going on this, I hadn't thought that much about this before. Another key thing is that despite uh, blockages that were placed on aid flows, Gaza had been, prior to the war and even for most periods during the war, quite a major recipient of aid. So during the war, even though aid was not flowing in completely freely, it depended on the period, and some periods it wasn't flowing in at all. But you had this big network of aid organizations that had distribution spots all over Gaza. Gaza is tiny. That's yet another important difference from Iraq. So it's tiny, it's well covered by aid organizations, with, of course, the important caveat that they were blocked out of the north for a considerable portion of the time. And so, but that made it possible to compensate for the huge amount of displacement by using that network to track the population movements. Okay, so actually, the more I get into this, the more I think it was really hugely different from Iraq in a lot of ways that made this pretty unique. If we try to apply this, in Sudan or something like this, it just like the challenges are just, I think, overwhelmingly greater, despite this being hugely challenging. Just the logistics of trying to get around Sudan. The aid network is not there, and so in a lot of ways, it was easier than it would have been in some other contexts.
Great. Thank you so much. I think we have time for hopefully at least a couple more questions. This is from the Q&A. Can you share some more about the experience of working with Professor Shikaki's team, how they managed to pull off such a large survey within less than a week in a region with power cut off, destroyed roads, and ongoing warfare, etc.?
Yeah. Well, I mean, the key to it is that they already had a large presence there. So there were 10 teams. There are also supervisors working there. Um, of course, we benefit logistically from the fact that there were only two accessible governorates. So they're not going all over, but Gaza is small, um, and then made even smaller by the inaccessibility of three of the governorates. So a lot of people conveniently, from the point of view of conducting the survey, they're organized living in close quarters in tent encampments, and so that helps. uh, and they're experienced survey researchers. They didn't need to be trained except really on specifics of doing a household mortality survey, because all of their prior experience was with public opinion surveys. So, um, you know, I mean, to a large extent, a survey is a survey, but still, uh, it was important to make them understand that the household is the unit of analysis, which it isn't for public opinion research. Public opinion research, you knock on a door, or maybe it's a tent, and then you have some randomization of eligible adults within the tent, and then any one of them is fine. Here you need someone to define for you a household composition as of a certain date, and try to be as rigorous as possible. So that was an important object in the training. But I guess the question is about logistics, and I guess I've done what I can to answer that. The questionnaire was short as well, so that also helps to explain how it could be pulled off so quickly.
Great. Thank you. And here's a broader question about doing this work in the university environment. What do you believe an audience in the university context should consider when developing dialogue and discussion surrounding these issues? It's a hot topic, as we all know. Do you have any advice for initiating these conversations in the workplace?
Well, I think it's a hotter topic in the U.S. than in the UK. I mean, I think we're not under the same um, pressure. We are under some kind of pressure, but you're not under the same kind of pressure that you are in the U.S. right now. But um, I think for me, it's to try to keep it as much as possible on the methodology and the science, and not on let's say normative conclusions to be drawn from it. I mean, that's easier said than done. The the survey has been in the public domain for some months now, and it has been attacked by various people. I mean, some people made some good points about the limitations. I think other attacks were not really in good faith, um, but I guess all I can say, just try to stay calm and and to the point to the extent possible. But it's inherently very emotional. People are very invested in it, so it's by no means easy.
Right, right. Thank you for that. And maybe one final question. We'll see. We've got about 5 minutes left. A really good question to perhaps end on. Are there plans for conducting an in-depth follow-up survey now that there's relative calm, hopefully, and access to more parts of the Strip, as well as additional deaths of the awful past half year?
Right. I have no concrete plans to do it. I would like to do it. It requires some funding. We struggled to get funding for this one, and I ended up sort of kicking in money out of my own pocket, to make this happen. The uh, but yes, in principle, subject to having some funding, I would like to do a follow-up, but there's no concrete plan to do it. I've heard about some other people who are interested in doing a follow-up survey. I'm pretty sure there will be something at some point, and I guess I'd like to be involved. There's certain advantages, I suppose, to having an entirely different team come in and find what they're going to find, whether it's consistent with us or not.
Okay. Just looking at questions that have come in just now. It looks like we still have a couple minutes left, so you're doing
Okay.
well.
Happy to keep going. Yeah.
Um, why did the study use the term Gaza Ministry of Health, or GMOH, which reflects I guess, in some people's minds, perhaps less legitimacy if it's being tied to local government and Hamas. The Palestinian Ministry of Health is a unified institution across Gaza and the West Bank. And this comment is saying it should not be narrated as separate. Do you have an answer to that?
So the suggestion is that it would have been better to call it the Palestinian Ministry of Health rather than the Gaza Ministry. Is that right? Is that what is being asked here? Yeah, it seems
I
so.
believe so, yeah. Now,
Yeah.
I'm getting a message from
Wow.
one of the people running the webinar that maybe we could answer this question live. No, no, I think we're okay. Yeah, go ahead. Yeah.
Well, I never thought about that. It never occurred to me to do that. My understanding, however, is that the Ministry of Health in Gaza is operating pretty independently of the West Bank based Palestinian Authority. Uh, so it feels to me like it's accurate to describe it as the Gaza Ministry of Health. I mean, we didn't follow the practice that it seems most media outlets are required to follow of calling it the Hamas-controlled uh, Gaza Ministry of Health. We just simply called it the Gaza Ministry of Health. I mean, that's its actual name, right? It's not named the Hamas-controlled Ministry of Health. So I don't know, but so if I'm answering the question as it's intended, I do think it's accurate to call it this in the sense that those the people who are really doing this they're all based in Gaza and are operating fairly independently of the West Bank, I think.
Mhm. That's wonderful. I think in our last minute, I guess I would like to give Dr. Spagat do you have a last word for us? You're deeply invested in this work. This is clearly something that you carry in your heart, making every casualty count. This means a lot obviously beyond the science and the methods. Any last message for many of the people who are watching today are public health students or part of our public health community? Where should we be taking this important work that you're doing? How do we keep moving forward with accountability and making every casualty count? What are your suggestions for us?
Okay, so thank you for that. I love that question. And because you embedded the name of the NGO that I chair, about 5 times. It's just great. So everyone Google that and have a look at that. Uh, maybe it's. I mean, I've tried to bring this out a lot during the talk, and you brought it out yourself. Exactly this point that we're talking about individual human beings, not numbers, despite the fact that still probably 80 to 90% of what I actually talked about were the numbers. I will say that a lot of people I encounter in the public health universe do seem to have kind of lost sight of this fact that there are the numbers and the estimates, and that's all very important, and we care a lot about that. And the tools that have been developed in public health, are really aimed at trying to do statistically valid estimates of numbers. But you should try to somehow in your mind uh, also remember the individuals. And sometimes the way this comes out is the people who are doing this work, which Every Casualty Counts calls casualty recording, which we would separate from the estimation, the one by one recording of people who've been killed, or in some projects, people who've been injured. That, because that number might be substantially below what a statistically solid estimate might come up with, we shouldn't just poo-poo that and just say that, that is just, garbage, that, is they're not estimating right. You know, that's not the way you do a statistical estimate. It's not what they're trying to do. They're not trying to do a statistical estimate. They're trying to memorialize individuals who have been killed. Now, of course, it's good to match that up against an estimate that we think is credible, and to understand, like, how much work is left. If we really want to memorialize every single person, probably we can't. I don't think we'll ever be able to make a completely compelling list of every single person who's been killed in the conflict, but we can get close to that, possibly. And that's valid and important work, but it's different work from statistical estimates.
Wonderful. I think we're going to have to stop there. Cannot thank you enough, Dr. Spagat, for both coming and sharing this with you and doing this incredibly important work. And I hope I will repeat it again. Every casualty counts. Everybody should Google that and follow the critical work that you're doing. We really appreciate it. Thank you so much. And thank you to the audience for taking the time to tune in on this absolutely critical and morally urgent issue that we're talking about today. And we will continue to be in touch. And thanks to everyone for taking part.
And thank you for having me, and thank you for all the great questions.
All right. Hey, take care, everybody.
Bye, everyone.